DD, that's me. DD, that's me. DD, that's DD, You wear a hat they call dad. Me, I'm a dad in a hat. You just like clubbing in clothes. Me, I like afternoon naps. 3 happy meals for the road. My oldest like counting racks. My middle one, she's in a dirt bike. My youngest is just like a mama. The mama loves me and I love her, so if she wants something, it's never about her. 3 little ladies, my babies, and 1 on the way. Now I'm stressing my mama. And don't try to play around, don't try to play with them unless you're looking for problems. Said don't try to play around, don't try to play with them. My brother's out with the drama. 4 to 5 nights on the road, counting the days till I'm home. I could do show after show, but nothing is better than home. Driving through nights I'm alone, counting the days till I'm home. I've been on road, I'm on go, but nothing is better than home. Clicking my heels like I'm Dorothy. I need new hobbies, it's boring me. Play all my kids and it's water me. I see new loafers, I'm motoring. I just want socks and stocks. I feel on top to top. Shipping and pop like pop. Still young in my 20s, I celebrate. This one for the dads, me dedicate. Head of the house like the head of state. Bring home the cash and the dinner plate. I go, I zoom, accelerate. I cannot be bought at some bargain rate. I got on my baby, my body weight. I stay in the crib like a quarantine. I stay in the crib and I isolate. Making my way, watch it demonstrate. I ain't no special, I'm a tidal wave. I came to win, I ain't gonna play. At my own pace and I'm never late. See this rap thing, it's the new to me. My only do this for like 2 or 3. I'll be down as long as it's true to me. Got records on records that's new to you, but none of these records is new to me. I used to skip class, now I'm tutoring. I was just a team with a GED. On paper was worth like a couple G's. That hustle and work, nothing new to me. Look back now, I'm worth like an Amazon. Never underestimate G.O.D. Don't give me what I want, but what I need. D.D. that's me. 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 D.D. that's DD, that's me. DD, that's me. DD, that's DD, You wear a hat they call dad. Me, I'm the dad in a hat. You just like clubbing in clothes. Me, I like afternoon naps. 3 happy meals for the road. My oldest like counting racks. My middle one, she's in a dirt bike. My youngest is just like a mama. The mama loves me and I love her, so if she wants something, it's never about her. 3 little ladies, my babies, and 1 on the way. Now I'm stressing my mama. And don't try to play around, don't try to play with them.
Welcome on this very, very beautiful Friday afternoon in Charleston, South Carolina. Welcome to Ask Dr. Geier Live. This is your one chance, one place to ask your orthopedic injury question, whether it's a question about the injury itself and how it happens, question about surgery, question about rehab, recovery, whatever you want to ask about, feel free. This is the one place, the one time I do that every week. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age, injury, or medical history. Good to see you. I would say your name, but I don't know what it is, so I'll just call you Pink for Pink Panther. If you have questions or comments on, or questions, I guess, feel free to make comments too. On YouTube, leave those in the chat, not in the comments below. I can't see the comments. I am sending this to YouTube and Twitter through Restream. Twitter, I have not actually been on the other side of this since I started having the ability to send to Twitter, so I don't know how necessarily you post the comments, but hopefully Restream shows them to me. Remember, this is not meant for medical advice. This is general information and education only. I haven't seen you, haven't examined you, looked at x-rays, MRIs, any of that. I'm not your doctor. You're not my patient. So I am not giving you medical information. This is designed to give you more insight into what the problem is, potential treatments and what have you, so that you can go to your doctor or your orthopedic surgeon and make the decision that is best for you. Ibrahim, if I'm saying that right, it's good to know. I will try to remember that going forward. And if you do want to see me specifically as a patient, I'll talk at the end of the show or at some point during the show about that. All right. William, chronic back pain, nearly 4 years. MRI showed a disc bulge. So it's interesting. Disc bulges are very common, and I don't know if this is necessarily your question, are very common in the adult population generally. When studies, and this has been done multiple times, have done MRIs on people with absolutely no low back pain, a huge percentage of them are found to have bulging discs. So there has been debate about the significance of those bulging discs. The good part about it is typically they don't need any kind of surgery. As far as recommendations, so I am a big fan of physical therapy. My experience, so I said earlier, it's not something that typically needs surgery. What potentially would need surgery is if you had a herniated disc that was pressing on the nerve root and nothing was working. I know some spine physicians and surgeons will try epidural steroid injections. Typically, again, disc bulges don't need that, but that can be a reasonable thing to try if physical therapy isn't working. I'm a big fan of penisin polysulfate that I've talked about in a number of my Better Than Ever live shows. That's a medication that's in phase 3 trials with the FDA, so you can't get it through your traditional orthopedic surgeon or primary care provider right now. You have to go to functional or integrative medical practice, but I've seen very good success rates with degenerative conditions of the neck and the lower back, so that can be helpful. Don't have as much experience or knowledge or have seen any studies related to low back pain, disc-related pain, and peptides, but that's something else that would potentially be a benefit. I'm not a tremendous fan of anti-inflammatory medications, for what that's worth, but those are some of the things I would think about. All right, Mary asks, well, come on, get on the screen. I may just have to read it. There we go. Mary, how long does a total knee replacement last? It's funny, I was just talking about this with somebody yesterday. Most of the manufacturers of those knee replacements and the surgeons that put them in now quote 20 to 25 years survivorship data. Does not mean that they absolutely will last 20 to 25 years, but typically they do. That has been one of the reasons I've really pushed back against this idea of the joint replacement surgeons starting to do them in earlier and earlier and earlier ages. Even people in their 40s. If they only last 20 to 25 years, you're very likely going to outlive that. And a revision, which is Mary's next question I'll put on the screen in a second, a revision is a much, much bigger operation because now you have to get that knee replacement out and all the bone that it's attached to, so you tend to lose a lot of bone. The recovery is a lot harder. So ideally, you would never want to have a revision knee replacement for what that's worth, so you try to put it off as long as you possibly can. I've said this multiple times recently on various shows that I do. I really believe over the next 15, hopefully even sooner, 10 to 15 years, maybe 20, 25 years, who knows, we will eliminate the need for hip and knee replacements with regenerative treatments and medications to stop the damage. Remember, arthritis is an inflammation problem, not a wear and tear problem. And I believe we will get to a point where we can not only prevent it, but we can reverse it when it happens. All right, Georgia is here. Great to see you. Hope all is well in Greece. William, you're very welcome. All right, Mary's second question, how do you know when it's time to redo a total knee replacement? So there's a couple answers to that. One would be if there's a problem with it in the first place, gets infected, you have potentially a fracture around it, or that usually they can treat without replacing it. Or maybe you have loosening of the components due to resorption of bone around it, what's called osteolysis, something like that. Or, right, you could just wear it out, wear out the polyethylene on the top of the tibia, the shin bone. The metal starts to wear out. Those would be indications. Typically, that would be something you would see on x-ray, and that's why most joint replacement surgeons bring you in every year or two to check x-rays, make sure nothing's changed. But also, it would be an increase in pain or something along those lines. That's really something that there's not an absolute right answer. Everybody's going to be a little bit different, but component failure for whatever reason would be, whether it's wear and tear or something else, would probably be the main reason. All right, let's see. Sandy, swollen bump outside of the knee after fractured kneecap 5 weeks ago. Bump seems to be slowly enlarging. Doctor said not to be concerned. So I'm not sure I understand. It, I guess, might depend on where that is. If it's outside the patella, outside the kneecap, my guess would be that that's just swelling related to bone leaking, leaking out of the fracture and causing a small hematoma. If the bump is somewhere else, then I don't know that I have a great idea of necessarily what that is. If it wasn't there prior to the fracture, you would hope, yes, it's not a big deal. You would assume it's not a tumor or a cyst that suddenly popped up, something like that. But without being able to examine you, I don't have a great it's hard for me to have a great sense. Biggest risks on a hip replacement, Elena asks. That's a terrific question. And this is really true with knee replacements too, but I'll say it specifically with hips. And why I feel so strongly you want to try to avoid that surgery if possible is, one, you can't go back once you do the hip replacement. So if it got infected, if you had some kind of issue, just constant pain after the injury, they can't go back and put in the worn out bone and cartilage. You kind of live with that. So that, maybe not super likely, but certainly worrisome. Probably with hips, the two big ones, there's always small chances of infection. That's not super likely, but it's possible, and it's devastating. It's a really bad problem if it happens. There's always risks of wear over a long period of time. But what I would look at is, one, a risk of dislocation of the hip. That's not something that the knee replacements don't have, but the ball can pop out of the socket, and sometimes that needs to be revised surgically. You could also break around the components, especially right below the femoral stem on the femur side. You can break below it, typically in people with osteoporosis. Now that's possible with knee replacements too. It's just typically you see it a little bit more in hips, but that is one of the potential risks. It's a good reason to, if you have osteoporosis, to maintain the bone density or restore the bone density, because risk of fracture afterwards is always a problem. Sandy, you're so welcome. I wish I could give you better ideas without seeing it, though. It's just really hard. All right. Angie, I've been told overhead actions are bad, pulling weights off the floor, deadlift, relatively safe after slap repair. Wouldn't the weight pull, pop the humerus out of the socket? It depends, first of all, on the type of labral tear and repair. If it's a superior labral tear, that's a little different than, say, a labral repair for a shoulder dislocation. Slap tears, superior labral tears at the top of the shoulder, typically not a risk for redislocation, because that's not how this superior labrum is torn anyway. But you're right, that would be possible if it's anterior especially, but also posteriorly. It depends on how far people are out. Usually it's really hard and probably not advised to do overhead activities for about the first 3 months after surgery. But it's also typically, you don't, at least when I was doing superior labral repairs, wasn't letting them lift really much more than maybe 5 pounds, even if it was in a deadlift type position, for that first 3 months. And it's just to minimize stress on the sutures and the anchors and the repair. So that would be kind of a better question for, if, somebody that, in your case, the doctor that did it, the surgeon that did it, in case there's something specific about that surgery. But typically I don't allow not just overhead weightlifting, but really much of any weightlifting with the arms for that first 3 months. I know it's not fun, but it's certainly better than needing another surgery. Alrighty. Ibrahim, how do I know if my shoulder's out of socket? Can it be out without having pain? No. That is not a subtle injury. Your arm is hanging loose and limp, and it is not only extremely painful, but you can't use it. No, that is not something that you would have and not know it. The pain when it happened, now there's no pain. Yeah, no, I can't imagine any scenario where somebody could have a shoulder dislocation other than it's been out for years and somebody that's basically not with it. I don't see any scenario. There's a lot of causes of shoulder pain and shoulder discomfort, but shoulder dislocations where the ball is actually out of the socket, that's not a subtle injury. Angie, you are very welcome. All right, any other questions? I will wrap up, but if somebody pops a question in the next 30 seconds or so, I will try to answer that real quickly. If you'd like to see me as a patient, I'm happy to do that. I see patients in Charleston, South Carolina. Again, I'm a triple board certified orthopedic surgeon, orthopedic sports medicine, and anti-aging and regenerative medicine expert. I can talk to you about all kinds of injuries, and all kinds of treatments, not just cortisone, not just physical therapy, and not just surgery, to try to not only get your injury to heal, not just prevent it from happening again, but to get you back to what you love to do, to improve your performance, improve your energy, speed, endurance, and all of that is part of the recovery process so that you feel and perform even better than you did in your 20s and 30s. If it all sounds interesting, the link to my website is in the description below, at least on YouTube, drdavidgeier.com, DRDAVIDGEIER. Go to the contact page, fill out that short little form. That gets to me and my assistant, and we can help set that up. I don't do virtual unless people are in certain states. So reach out to me and figure that out. It's all based on medical licensure, and I only have licenses in a few states. So right now, no, but there are sometimes things we can do. But yeah, it typically, for something like Zoom or virtual, it has to be in a state that I have a license. That's true with all telehealth, to be perfectly honest. Grinding sounds in the knee, total knee replacement done 25 years ago. So the grinding sounds could be from the knee replacement starting to wear out, but there's other causes of clicking and popping and weird sensations in the knee. The best way to check that out would be sorry, I was going ahead and reading Georgia's comment, virtual. Yeah, the problem is in the United States, you can't practice medicine in states you don't have a license, and where the appointment takes place is where the patient is, not where the doctor is. So basically, the people that only do telehealth have licenses in all 50 states. It is an absolute nightmare to get a state license, let alone 50 different ones. There's a few that have reciprocity, but not so much. That was one of the interesting things. Allegedly, President Trump, when he was president, was going to eliminate that and make a federal medical license so you could practice in all 50 states. I don't know if that's true. That's just what I hear. This is not a political statement, but that would be ideal, honestly. As far as other countries, there's all kinds of issues there in terms of what treatments are allowed, and I wouldn't even begin to know. I've got somebody coming from Europe later this month, and yeah, that's what we had to do. She's got to come here. But anyway, back to Mary's question. The only way to really know if the clicking, grinding are coming from the knee replacement would be to go see the orthopedic surgeon and get x-rays and see what it looks like. All right, that is all I see. So we're going to wrap it up. I am very, very excited. This is actually the last Ask Dr. Geier Live of 2022. I am going to be out the next 2 Fridays, but then we will get back to them first week of January, or at least soon thereafter. I want to mention I am I am signing up as an expert for the social media app Good Self. It's a health-only site. It's like, if I had to say, it's a combination of Instagram and Clubhouse, but should be really exciting. Talks by medical experts and health experts, posts, discussion forums, support groups. Should be really interesting. I literally just signed up today. I've talked to the CEO of the app multiple times, and it really looks exciting. So if you're interested, you might check out Good Self. All right. Ibrahim, Merry Christmas to you and Georgia. I will enjoy my weekend. Very, very excited. Mary, You are very welcome. Very happy to be here. I apologize again for not being here the next 2 weeks. Just a lot going on with family around and things like that. So I really, really wish you nothing but the best over this upcoming holiday season. Please stay safe. Enjoy it, but please stay safe. If you're driving, be careful. If you're flying, be patient. And I hope that we can all get back together in 2023. William, thank you very much. Happy holidays to you. Happy holidays, Merry Christmas, and Happy Hanukkah, everybody, and all there's so many holidays. I'm not going to get into all that, but very, very grateful for all of you. So you all have a wonderful rest of your weekend, rest of your holidays, and rest of 2022. I will see you in 2023. Have an amazing, amazing rest of your month.